Herbs to support inflammation and joint pain. Ginger, we talked about briefly, as a herb that could be useful for reduction of nausea, for indigestion. Well, ginger at a higher dosage of 1500 milligrams daily for 12 weeks reduce inflammatory cytokines in patients with rheumatoid arthritis. Another herb is devil's claw, and a tincture is going to be at 1 to 3 milliliter either twice or 3 times a day for patients with arthritis. We talked about curcumin. It's a wonderful compound that's derived from the rhizoma, the underground stem of the plant Curcuma longa. Curcumin has a powerful antioxidant and anti-inflammatory property, one of the most active constituents of turmeric. Meta-analysis studies of randomized clinical trials provided evidence that supports efficacy of turmeric extract with even just 1,000 milligrams a day in the treatment of arthritis. In comparison to a drug that most patients use, that would be the non-steroidal anti-inflammatory drugs. That would be Aleve, ibuprofen, Advil, sometimes aspirin, right? How effective is curcumin? Well, I wanted to take a look at this interesting study that basically took a large group of patients, 367 primary knee osteoarthritic patients, so patients with degenerative condition of the knee. Those patients will typically have loss of meniscus, sometimes even a loss in the integrity of the bone in the joint, and they were randomized to 2 groups. One group received 1,200 milligrams of ibuprofen per day. The other group received curcumin extract of 1,500 milligrams a day for 4 weeks. This was a double-blind study, so the capsules were identical in appearance, and patients were asked to take these pills in three dosages per day. Well, what was the result between the 2 groups? After 4 weeks of study, the researchers concluded that curcumin extract were as effective as ibuprofen for the treatment of knee osteoarthritis. The number of events of abdominal pain discomfort was significantly higher in the ibuprofen group. That's because we know that NSAIDs, the non-steroidal anti-inflammatory drugs, might increase the risk for ulcers, bleeding, digestion problems, all the way to even cardiovascular problems, even a stroke. Using curcumin, this study has shown that using curcumin could be, for many patients, a safer alternative to using those anti-inflammatory drugs. IL-6 is also involved in the pathogenesis of different inflammatory diseases, and curcumin can be considered as a potential therapy against the increase of IL-6, which involves pathologic conditions. Interesting, in this particular study, the Arthritis Research and Therapy, the study is called Curcumin-Mediated Suppression of Nuclear Factor Kappa Beta Promotes Chondrogenic Differentiation of Mesenchymal Stem Cell in High-Density Co-Culture Microenvironment. What they concluded was that curcumin alone does not have chondrogenic effect on stem cells. It's not going to induce a stem cell to rebuild the meniscus in those patients' knees or joints. However, it does inhibit the pro-inflammatory cytokines, the bad inflammation, and it supports the regeneration of the articular cartilage by enhancing the production of collagen type 2 and also collagen-specific peptidoglycans and beta-1 integrin, right? So there's all these proteins that are fundamental in building our cartilage. So curcumin can support the whole process of regeneration because it's anti-inflammatory, it inhibits the bad inflammation, and it also helps with regenerating and hence the production of collagen type 2. Curcumin bioavailability. There is a lower bioavailability for curcumin, unfortunately, which means that it's not absorbed very well from our digestion tract into the rest of our body, into our bloodstream. However, you can increase the bioavailability, the absorption of curcumin, by adding piperine, which is the major active component of black pepper. Even small amounts, like anywhere between 3 milligrams all the way to 10 milligrams, were found to increase bioavailability by up to 2,000%. So you can lead to much better absorption of curcumin with just adding a little bit of black pepper. Some vendors will already have pepperin or black pepper in their capsules or tablets to allow better absorption. Who would you want to use curcumin with better bioavailability and who you won't? Patients that come to see you, clients that come to see you, and their major complaint is inflammatory condition of their gut, like Crohn's, colitis. You will typically want to use a lower bioavailability because you want curcumin to work mostly on reducing inflammation in the digestion tract. With patients that have out of digestion tract problems like arthritis, patients that have neuroinflammation, right? Patients that have systemic inflammation or inflammatory skin conditions, you want higher bioavailability, and for those patients, adding pepperin is going to be a better idea. Another herb to help support inflammation and joint pain is Boswellia. It's a natural and affordable agent that can reduce inflammation. Typically, we recommend it between 250 to 1,000 milligrams twice a day. The use of Boswellia and curcumin together is well tolerated and safe and creates a better effect when combined together. So, as I mentioned, curcumin combined with boswellic acid extract led to improvement in physical performance and reduction in joint pain and morning stiffness. The use of both Boswellia and curcumin supplements were well tolerated and safe in this clinical trial. When you combine herbs, you can typically use smaller amounts of those herbs because you now have different herbs that might work differently, but they all work towards the same goal, which is reducing inflammation and pain. So we've seen when combining Boswellia and curcumin, you can even just use 1,000 milligrams of curcumin with 500 milligrams of Boswellia, and you're already going to get a really good benefit with most patients. Now, how does Boswellia serrata works? Well, there is an enzyme that is called 5-lipoxygenase, and that enzyme is what leading and driving to promote free radical damage, calcium dislocation into the joint, cell adhesion, and migration of inflammatory producing cells to the inflamed body area. And that leads to or aggravates the inflammation. Well, the boswellic acid found in the Boswellia plant block that enzyme from creating or aggravating that inflammation. And so this is why it's such a good combination with curcumin, because curcumin might downregulate and reduce some of the pro-inflammatory cytokines such as interleukin 6, while Boswellia will block some of the other enzymes that lead to inflammation. Right? Remember, there's many pathways to inflammation, and we want to block as much as we possibly can to reduce further damage and reduce pain and other symptoms. Another important compound when we talk about inflammation and joint pain is Hesperidin. It's a flavanone glycoside which is found in citrus fruits and was first isolated in 1828 by a French chemist from white inner layer of citrus fruits. Hesperidin inhibits the secretion of pro-inflammatory cytokines such as interleukin 2, interleukin 4, interleukin 10, and some studies report that hesperidin and other bioflavonoids such as diosomid from peels of citrus fruits as well are beneficial for improving function and integrity of blood vessels and prevent microcirculatory complications after surgery or varicose veins or swelling. When combined together, you can use it for vein function. You can use 50 to 150 milligrams per day for joint pain and inflammatory conditions, and higher dosages of 500 to 600 milligrams of bioflavonoids for vein function, right, or better vein integrity. Another compound is Bromelain. Here's a direct citation. Bromelain is a food supplement that may provide an alternative treatment to NSAIDs for patients with osteoarthritis. It is extracted both from the stem and the fruit of the pineapple plant. The mechanism is decreasing bradykinin level, which results with reduce vascular permeability, so it reduces that swelling and edema and pain. It mediates prostaglandin levels. It increases serum fibrinolytic activity, and the dosage is 200 milligrams to 400 milligrams of bromelain 2 times a day. And what it is basically, it's basically an enzyme that helps to also break down food. So this could also be useful for patients with digestion problems, patients with inflammatory conditions, patients with histamine reaction like allergic reaction as well. Gastrointestinal side effects reported above 940 milligrams per day. So typically 200 to 400 milligrams should be 2 times a day, should be fine. And we found that even that 200 to 300 milligrams twice a day already had some pretty significant clinical benefit.